Good morning to all. Myself Arthi, Designation Assistant Professor, Department Medical Surgical Nursing Department from ES College of Nursing. Today we'll discuss about the stroke. So stroke it is otherwise known as cerebrovascular accidents. So first we'll see about the objectives of the topic, definition of stroke, types of stroke, pathophysiology and clinical features and investigations of stroke and medical and nursing management of stroke. So first we'll see the introduction. So introduction of stroke. So in the 1817, the World Health Organization defined stroke as a neurological deficit of cerebrovascular causes that precedes behind 24 hours or is interpreted by death within 24 hours. And next is the definition. So definition of stroke. The stroke occur when there is a ischemia to part of the brain of hemorrhage into the brain that result in death of the brain cell. This definition given by Lewis. And one more definition is a stroke occurs when the blood supply to the part of your brain is interpreted or reduced, depriving brain tissues of oxygen and nutrition. Within a minute, brain cells beginning to die. This is the definition. And next is the incidence. So in incidence, most of 60 to 65 years people are more affected from stroke. The stroke happen every 40 seconds and every minute someone dies of stroke. The incidence of stroke increase with age. Mainly the people between 40 to 60 years are affected. The brain stroke occur 30% of more frequently in men than women. In 2020, the number of cases of stroke would increase to 1.6 million in the country. And next is the risk factors of stroke. So risk factors of stroke, it is divided into two. So modifiable risk factors and non-modifiable risk factors. So first we will see the modifiable risk factors. So modified risk factors, age, gender and family history. It's already I was said. So age of most in 60 to 65 people are 60 to 65 people are more affected from stroke, and genders, it is males are more affected from stroke compared to women. And next is the family history of stroke. And next is the modifiable risk factors. So modifiable risk factors means it is the hypertension, diabetes mellitus, smoking and excessive alcohol consumptions, drug abuse, obesity and heart disease and lack of physical exercise. These are all the things modifiable risk factors. So next we will move on to classification of stroke. So classification of stroke, it is divided into two major categories. So first is the ischemic stroke and hemorrhagic stroke. So on ischemic and hemorrhagic stroke, it is further divided into some classification. So first we will see about the ischemic stroke. So ischemic stroke result from inadequate blood flow to the brain from partial or complete occlusion of the heart. So ischemic stroke means it is the inadequate blood supply to the brain. So it accounts for 83% of all type of stroke. So already was said. So ischemic stroke, it is further divided into two types. So first one is the thrombotic stroke and next one is the embolic stroke. So embolic stroke means it is a movable one. For example, it is any air bubbles or any blood clot substance or any other fatty substance. These are all the things embolic stroke. So first we will see the thrombotic stroke. So thrombotic stroke occurs when a blood clot thrombus forms one of the artery that supply to the brain. So it is the thrombotic stroke. So thrombotic stroke means it is a blood clot. So it is travel to the blood circulation and obstruct the blood circulation to the brain. It leads to development of stroke. And next is the embolic stroke. So embolic stroke already was said. So it is a movable one. So embolism means it is a blood clot or other debris circulating in the blood. When it is reach on the artery in the brain that is too narrow to pass through, it lodge there and block the flow of the blood. The majority of embolus is originated in the endocardial layer of the heart and block the circulation of the heart the embolus travel into the upper to the cerebral circulation and block the brain circulation. So the embolus it is also affect the heart functions. So once the embolus it is travel to the blood circulation, it leads to affect the brain blood circulation. So next is the hemorrhagic stroke. So hemorrhagic stroke occurs when the blood vessels in your brain leak or rupture. The brain hemorrhage can result from many conditions that affect your blood vessels. It accounts for 17% of all type of stroke. It is divided into two types. It is the intracerebral hemorrhage and subarachnoid hemorrhage. So first we will see the intracerebral hemorrhage. So it is an intracerebral hemorrhage. The blood vessels in the brain burst and spill into the surrounding brain tissues and damaging the brain cells. So intracerebral means it is the inside of the brain. It is called as intracerebral. And next is the subarachnoid hemorrhage. So subarachnoid hemorrhage, an artery on near the surface of the brain burst and spill into the space between the surface of the brain and skull. It is called as subarachnoid hemorrhage. And next is the TIA. So it is very important one. So very important in the stroke. So TIA means it is the transient ischemic attack. It is a warning sign of stroke. It is otherwise known as mini stroke. In TIA, persons who are having the TIA mean now the time patients having the some of the signs and symptoms, especially in the vision loss and paralysis of the hand and behavioral changes. These are the symptoms of TIA. It is one of the warning sign of stroke. Okay, so TIA it is sometimes known as mini stroke. The temporary decreasing in blood supply to the parts of the brain causes TIA, which may last as little a few minutes. Okay. And next is the next we'll move on to pathophysiology of stroke. Okay. So due to etiological factors, like modifiable and non-modifiable, like the thrombosis or embolus obstructions in the blood vessels, it leads to development of cerebral blood flow decreased to less than 25 ml per minute. So once any thrombosis formations or any embolus formation. So thrombosis means it is the blood clot and embolus means it is the movable one. The example blood clot or any air bubbles or any fatty substance. This substance it is travel to the brain blood circulation. Now the time the block the circulation of the brain, it leads to development of decreased blood flow to the brain, especially in the less than 25 ml per minute. It leads to ischemia cascade beginning. So once your brain receiving the decreased blood supply, now the time the ischemic formation will be started. It leads to the neurons are no longer able to maintain the anaerobic respiration. The mitochondria switch to maintain the anaerobic respiration. So mitochondria it is very important role to maintain the brain function. So main functions like that mitochondria it is maintain the mitochondria it is otherwise known as the powerhouse. It is maintaining the energy of the nerve cells. So once the switch of the mitochondria function, now the time the neurotransmission will be affected. Okay, so the neurons are no longer to maintain the anaerobic respiration. So anaerobic respiration means the anaerobic means it is the lack of oxygen supply to the brain. So next is the excessive influx of cellular calcium and released glutamate activated damage pathway. So glutamate and calcium. So already I was said, so mitochondria it is also maintaining the electrolyte balance function. So mitochondria it is maintaining the calcium functions also. So once the mitochondria it is the mitochondria function it is altered, now the time automatically the glutamate and calcium functions will be changed. So glutamate it is maintaining the cognitive functions of the brain. So once the glutamate function it is increased, the glutamate secretion will be increased in your brain, means now the time the brain neurotransmitter will be altered, especially in the patients getting any brain disorders like that age related problems, and patients having any seizure and stroke. This type of symptoms will be this type of disease condition will be patient getting. It leads to destructions of the cell membrane and vasoconstriction. So that's all about pathophysiology. So next we'll move on to clinical manifestation. So clinical manifestation, it is the visual field deficit. So in visual field deficit, it's having the patients having the loss of peripheral visions and diplopia. Diplopia means it is a double vision. Next is the motor loss. So motor loss means it is the hemiparesis and hemiplegia and ataxia. So already was it. So mitochondria is maintaining the electrolyte balance. So once they alter the mitochondria function, so mitochondria is producing the energy to the nerves. Okay, so once the mitochondria it is maintaining the not maintaining the functions, now that time the glutamate will be the glutamate functions will be increased. Now the time the changes the cognitive functions like that hemiparesis and hemiplegia and ataxia. And next is the sensory deficits. It is a difficulty in interpreting visual auditory stimuli. And next is the verbal deficit, dysarthria, excessive aphasia. And next is the cognitive deficit, is the short-term and long-term memory loss. And next is the emotional deficit, it is a depression, fear, anger and feeling of isolation. And next is the diagnostic evaluation. So diagnostic evaluation, it is the first one is the history collection. So in history collection, you collect the history of family history. So already I was said in your risk factors, modifiable and not modifiable risk factors. So first of all, in history collection, you collect the family history of stroke. And next is the collect the patients having any past medical history, especially in the patients having any hypertension and diabetes mellitus or any other patients getting cardiovascular problems. So these are all the risk for a persons getting the stroke. Okay, and next is the in physical examination, and next is the CT scan. So in CT scan, it is very important one. So CT scan, it is help to identify the size and location and differentiation between ischemia and ischemic stroke or hemorrhagic stroke. And next is the CTA. It is a computerized tomoangiography. So in CTCA, computerized tomoangiography. So in MRI scan, it is help to identify the brain and blood vessels abnormalities, and PET, it is show the metabolic activities of the brain, show the extent of tissues damage. And next is the SPECT, it is a single photon emission computer tomography. And next is the angiography, and next is the skull x-ray, and next is the EEG, and last is the lumbar puncture. So lumbar puncture, it is help to identify the composition of CSF fluids. And next is the management. So first management is the initial management. So ensure the patient airway and maintain adequate oxygen with the supplement of O2. And next is the establish the IV assess for the guidelines. And next is the obtain CT scan and immediately, and anticipated thrombolytic therapy for ischemic stroke. Next is the in aspirin. So medicine name, it is a aspirin 325 mg OD given orally to prevent the blood clot. And next is the intravenous injection of tissue plasmogenic activators, TPA. It is also called as altiplase. It is help to clot bursting, need to be given 4.5 years after stroke symptoms. And next is the surgical management, and surgical management for ischemic stroke. In ischemic stroke, the surgical management like that, it is a carotid enterectomy, the surgical procedure to open or clean blockage in the carotid artery. And next is the bypass graft. So bypass graft, it is in case of patient with intracranial occlusion such as of internal carotid artery or middle cerebral artery. And next is a thrombectomy for patient with identify the thrombus in order to restore the circulation. And next is the hemorrhagic stroke surgical management. So surgical clipping and surgical coiling. So surgical clipping means the clipping is placed in neck of the aneurysm to stop bleeding. And next is the surgical coiling. A long thin tube is inserted through the tube into the aneurysm balloon to fill the space and seal off the bleeding. And next is in hematoma, craniotomy may be required. And next is a complication of cerebrovascular accident. So paralysis of loss of muscles movement. And next is the difficulty in talking or swallowing. And next is the emotional problems. And next is the changes in behavior and self-care ability. And next is the cardiac dysrhythmias. Next we'll move on to nursing management. So maintain patient airway, monitoring for changes in the client level of consciousness, assist with the communication skills if the client's speech impaired. And next is the maintain safe environment or reduce the risk of falls and positioning for the patient. These are all the things nursing management. And next we'll move to nursing diagnosis. Impaired physical mobility related to hemiparesis. And next is the acute pain related to hemiplegia. And next is the disturbed sensory perception related to altered sensory perception. Next is the impaired urinary elimination pattern related to flaccid bladder. And next is the disturbed thought process related to brain damage. And next is the impaired verbal communication pattern related to brain damage. Okay, so next I was conclude my topic. So in this topic I was discuss about the introduction, definition and incidence, risk factors. So risk factors is divided into two types, modifiable and non-modifiable. And next is the types of stroke I was discussed. So types of stroke, it is a thrombotic stroke and hemorrhagic stroke. And thrombotic and hemorrhagic stroke is again divided into some types like that ischemic stroke, ischemic stroke and hemorrhagic stroke. And next is the pathophysiology and clinical features. So clinical features are patients having the vision problems and paralysis and memory loss. And next is the diagnostic evaluation. Diagnostic evaluation I was discuss about the hist collection and physical examination. And next is the CT scan and lumbar puncture. And next is the medical management. And medical management mainly given the thrombolytic agents to burst the blood clot. And next is the nursing management. These are all the things I was discussed. Thank you.